Okay, good morning, good afternoon, good evening, everyone. We're so glad that you could join us today. Welcome to International Medical Corps' briefing to discuss the current wildfire situation in Southern California and how International Medical Corps is responding. I'm Rebecca Milner, International Medical Corps' Chief Advancement Officer, and we're delighted that you've taken the time to join us today. Many of you on the call have generously supported our work over the years, and we want to thank you for that, for both your financial support and your trust and commitment to us. Your support makes our work possible, and we couldn't do it without you, so thank you. We're going to keep today's briefing as efficient as possible. We're going to wrap up in about 30 minutes. So as we're talking, we'll take a few questions. So please feel free to type your questions into the Zoom Q&A, and we'll do our best to get to them. Today, I'm very happy to welcome our colleague, Erica Tavares, Senior Director for our U.S. Programs and Institutional Advancement. She's leading our response to the wildfires. Glad to have you here, Erica. Thanks for joining us. For those of you who are joining us today from Los Angeles, I just want to stop and say, we're thinking about you, and we know that this is going to be a long-term recovery process. And so just wanted you all to know that our thoughts are with you, and that we know that it's going to be a long road, but International Medical Corps is going to be there. So I think, most of the people in the LA area, know exactly the day of when all the fires started and what was happening on January 7th. I mean, our team in particular, as everybody knows, we're based in Los Angeles. We have very clear memories of that day. We could see the mountain range and the Palisades fire start right there mid-morning, and we knew it was going to be significant. And we, sprang into action right away. We had a team on the ground responding within 24 hours. Maybe Erica, you can talk a little bit about, what those early hours are like in response to a rapid onset situation, and how do we kind of mobilize around it?
Sure. And just thank you, Rebecca, and just want to echo the thanks to everybody on the call, and also to the support of those in Los Angeles and the LA community. As our response has grown, we've brought in a tremendous number of volunteers, doctors, nurses who are from in and around Los Angeles, but also California, and have just seen a really great community response. And so just thank you for that as well. But yes, in the early days, for us, the focus is really on getting in a core team of individuals that can very, very quickly identify and deliver urgent relief items to meet those acute emergency needs. And so, when people are displaced, and in this situation in particular, as many know, having to leave their homes very suddenly, being in possibly in a shelter or other type of temporary housing situation, a lot of the basic needs aren't available. And so our priority in those very, very early days are to check on the partners that we work with and see, how we can help, but to really figure out what the items are that are going to be needed most to help keep individuals healthy and help them to be in whatever housing environment they're in, and feel safe, and that they have dignity, and that they can kind of take care of their personal health. And so a lot of the things that we do in those early days are delivering things like hygiene items, toothpaste, toothbrushes, Band-Aids, brushes, sanitary items, things that help people just meet their day-to-day needs, and so that they can feel safe and comfortable to the extent that they can. We delivered a lot of masks in those early days. We still continue to deliver a lot of masks because the air quality was so poor, and remains so poor, especially for people who might have chronic illnesses or chronic diseases like asthma, hypertension, COPD. You want to make sure that people have that protection. So that was our real focus very early on. Other types of things we delivered were diapers, recognizing that people often have to leave their homes without all of the supplies for their kids. We did toys very early on for the shelters. Again, recognizing that we're bringing whole families into shelter environments with very little that they had. And, it's very distressing for children, obviously. And so to the extent we can provide some kinds of comfort, we're doing those types of things as well. Pillows, blankets, things that are just going to make families and people more comfortable wherever they might be. And a lot of that learning, those needs come from the communities themselves, but it also comes from our learning of doing this for years and for decades around the US, but around the world. What are the things that are going to make individuals feel most comfortable in those early days when there's just a lot of chaos, and we're trying to, as an organization, coordinate with all of the other responders on the ground to see where we can help most.
Right. So mobilizing essential supplies was sort of, step one, and figuring out how to distribute them where and where the greatest need was. But it soon became clear that there were some medical and mental health needs. So maybe you can kind of give us an update on sort of our fully fledged response right now.
Sure. So in addition to continuing to deliver those supplies, International Medical Corps is working very, very closely with response partners, including the American Red Cross, Kaiser Permanente, Altamed, all of whom are providing medical and mental health care, LA County Mental Health, CAL FIRE, and other entities. And what became very clear very quickly was there were two types of interventions that were needed. And we actually first started with mental health care. Individuals, families, in whether it was in shelters like the Pasadena Convention Center and the shelter in Westwood, or at distribution sites where they might be picking up goods. A lot of these were informal at places, churches and community centers. We did a lot of sort of what's called walk and talk, sort of being able to go up to individuals and check in on them and see how they were doing and how they were coping, and really have a one-on-one informal conversation and consultation, because everybody had just been through so much. And it was really, in those instances, it's really important that people can have those conversations so that they can continue to do what they need to do to support their families, find housing, get to work, run their day-to-day lives, and have an outlet and a release for that stress. We've developed and put together a great set of resources that are based in LA County, as well as some online apps. We'll share it in the chat, but it was really, working with the Red Cross to identify those specific sites where we were seeing the most mental health needs. That was one of the first things that we did. As our relationship with the Red Cross grew, as the needs became more apparent, we've also started deploying medical teams. And so we're now running all of the medical services in the Pasadena Convention Center. That has about 325 residents still living there. And so we're running 24/7 medical and mental health services there. And then we're also doing at the Westwood shelter, which is closer to the Palisades fire. They still have about 50 people in that shelter. And we're, again, providing medical and mental health care in sort of the afternoon and overnight hours at that shelter. We've also been asked to expand some of our medical or our mental health services. For those of you on the call who may live in or near Santa Monica Pier, you'll know that that's a re-entry point for individuals going back into areas that were affected by the Palisades fire. Our teams are on the ground, going car by car, checking in with individuals, making sure they have some of the basic needs, things like water, masks, but also doing mental health consultations, making sure that people know that resources are available. And then we've also worked with a great free clinic partner out of Orange County who's lent us a mobile medical van. And we're looking at sort of being able and available at a number of sites around the county to really meet with people when they're at those reentry sites. It can be an incredibly difficult and emotional time when they're going back into their neighborhood for the first time, seeing what's left of their home, what's left of their neighborhood. And so making sure that we have a team on site, again, to provide both mental and medical health services. So, this is when we talk a lot about an organization in filling gaps. This is the kind of flexibility that we talk about. We work day to day with all of the responders to see what's needed today and how we can flex our team to get the care to where it's needed most.
Yeah, I mean, you talk about all our partners. I mean, I think one of the reasons that this was so complex that it covered such a wide geographic area, and it was also different, municipalities, right? So it was the city of Los Angeles, the county of Los Angeles. Maybe you could talk a little bit about coordination efforts, right? And how all of that shook out.
Yeah, it was a very wide swath of the region. I mean, it of course was all across the county. And so LA City had a response mechanism, LA County has a response mechanism. The California Department of Public Health and Cal EMSA, the Emergency Management Services Authority, they had response mechanisms. And what was unique or sort of added a layer of complexity to this was that the fires were still burning while individuals who had been displaced, needed evacuation. And so in many natural disasters in the US, sort of the event happens and then, right, the community can pull together to support those who've been affected. But in this case, it was really splitting resources. There had to be an enormous number of resources directed to putting the fires out and caring for those firefighters, while at the same time there needed to be a coordination mechanism among those who were providing services and support for people who had been evacuated and people in the community. And that was it was challenging. It remains challenging because it just sort of adds a layer of coordination complexity. But I think it's something that we at International Medical Corps do really well because we're used to these kinds of environments. And so we maintained communication with, the state and what the state's response was, as well as being really tied into the county and to the Red Cross.
Surprised you about this emergency? I mean, we had just spent the 2024 responding to a whole host of hurricanes and extreme weather events across the southeast part and the Caribbean. How is this a little different? How is this the same? Or were there any surprises?
Right. I think the scale certainly, and just how broad of an area this disaster covered and how many people were.
And how long? I mean, this went on for three weeks,
Right.
essentially, right?
Right.
Yeah.
And, the fires are still burning. Most of them are 95% or more contained, but it is still happening. So the amount of time that the emergency happened and just the breadth of space that it covered. And so that in and of itself created challenges. And I think, having been on the ground and being in LA when the third fire broke out, the Hughes fire, also just seeing and sort of coming face to face with the speed at which these fires move. I mean, I can very quickly remember looking at, the app, the notification, right? And it was 50 acres. And then an hour later, it was 500 acres. And then within an hour, it was 5,000 acres. And just the enormity of, and the speed at which that fire sort of took over, and, as you were watching it, and just how complex that then makes a response, because people have to get out so fast with so little warning. And so, that had added challenges. In that case, we, worked very quickly with the Red Cross to divert resources to make sure that we had a medical team at the shelter that opened up in the Hughes fire. And we were able to do that within a number of hours, but it did require a speed and a flexibility and an agility that was beyond a lot of what we see,
Right.
in many of our responses. I think not surprising, but I think just so important to remember. And it sounds a little intuitive, but so much of the coverage of an event like this, we're talking about acres burned or
Structures destroyed.
right. The human recovery from this is going to take so long. 200,000 people over the course of the last several weeks were evacuated or displaced, and many of them, can't go back to their communities, even if their house is still there. These communities were so badly damaged. They don't have infrastructure, power or water or gas. And so they really are going to have to figure out a more permanent solution and where they're going to go moving forward. And I think in talking with evacuees, what that's done to them personally, but I think how closely tied people are to their homes and how important they are, and that there's a tremendous amount of loss and grief that individuals are experiencing. And I think the mental health component of this and what we as an organization, but also as a community, can do to support individuals that have survived this and have seen that loss and grief is going to be incredibly important in the weeks moving forward, because it just really is. It will change the landscape of these communities. Pieces of them won't come back ever the way that they were. We've seen that in other disasters as well, but that can be very, very difficult.
Right. Well, and I know in a fire situation, I mean, it can take so long to rebuild as well. So we're talking about this going on for years, right? Before, right, right. Maybe you could talk a little bit about sort of the US response and some of the gaps that exist around health service provision, both mental health and medical services.
Sure.
Because I think that's just an important thing for people to recognize. I mean, and how we're reliant on existing health
Right.
services.
Right. So the U.S. response mechanism, sort of all of those incident command and things people might hear, is really very focused first and foremost on providing people who are affected with food, water, and shelter. So it's the immediate thing that's happening, putting out the fire, search and rescue, and then food, water, and shelter. And while health is considered, it is not sort of a primary part of that early response because for such a long time, the default has been that hospitals or local health facilities would be able to step in and take on that emergency response. But as disasters are getting increasingly more devastating and larger, and as they're getting more frequent, the hospitals and health facilities themselves are being affected, or they're just simply being overwhelmed. And so that brings on, it raises the importance of being able to provide medical care or medical services during a response, and in shelters or in other places because those things aren't readily available. And so in this shelter environment in Pasadena, we're going on week 3.5, 4 now. These are individuals who are not by their primary care provider. They may be running out of medication. We're trying to keep individuals out of emergency rooms because that just really overwhelms emergency room staff. And so you really do need, long-term primary care providers in those sites to really act as temporary clinics for all of the individuals who are living there. Uh, that's, and then you sort of also have the other side of it, which is the frontline health workers themselves are affected.
I was
And
going to ask about that. Yeah.
so, we have one partner, we work with a lot of community clinics that work with some of the most vulnerable and underinsured clients in the area. One of them lost a clinic entirely in Altadena, but they've had staff that have lost their houses. They have evacuees, staff that were evacuated and sort of are struggling to be able to make it to work or afford their new situations. And so one of the things that we're doing and one of the ways that we're working is helping those health centers support their frontline health workers so they can be there for their communities. So we're shoring that up, and we're doing that by offering housing allowances, other kinds of support directly to frontline health workers. And the same thing happens in communities. One of the really important parts of making sure people can continue to access healthcare is making sure that you're making it as easy as possible and they have the resources to do so. And so we're also looking at things like, can we waive copays at some of these health facilities, or can we cover prescription costs? So that the additional financial burden that some individuals might have right now doesn't force them to miss health appointments or push them off or push off getting their prescriptions refilled so that they can continue to stay healthy. I mean, these are things that you see when there's a longer term impact on the community as opposed to a disaster that is sort of addressed and rebuilding can happen very quickly in a matter of weeks as opposed to months and years.
Right. And I mean, I think one specific challenge that Los Angeles faces is the population of people who are experiencing homelessness. So maybe you could talk a little bit about some of the work we're doing with our partners there.
Sure. So we have, as an organization, we've been working with, providers that provide services for people who are experiencing homelessness. Throughout this crisis in particular, we've worked with them to make sure they have the ongoing support that they need to be able to provide care to their clients, some of whom were displaced themselves. Some transitional housing sites had to be evacuated. And so we're offering and working to offer with them housing vouchers if that's something that they need, making sure that they have the goods and resources that they need to be able to continue to provide care. And then moving forward and sort of before the fires, but also, it'll continue after the fires. We're also working with organizations like that to build up their own ability to prepare for disasters. Again, because just the scale and the severity of some of these disasters, whether it was some of the flooding events in Los Angeles last year, it's the fires this year, how do you help organizations who may not be used to dealing with disasters at this scale really think through and prepare for that so that they have action plans and can keep their clients safe and healthy when it does happen.
Yeah, I mean, I know that we've been doing a lot of that, predominantly in the southeastern part of the United States, but but I mean, what are some of the things that emerge from these kinds of conversations that you're having with these? I mean, and how do our partners, how are they working to prepare?
Right. I mean, preparedness is, something I've said is it's not a one-time investment. You have to continue to adapt and prepare. And a lot of times what happens is that organizations will write a preparedness plan and they won't test it. They won't pull it back off the shelf. They won't write check mark done.
Right. Yeah.
And so a lot of what we do in the communities where we work and in the Southeast, but also in California, is really work particularly with local clinics and then the associations they belong to at the county and state level to run really hands-on and ongoing training programs where we're sharing best practices about disaster preparedness. We are conducting after-action reviews. We did a region-wide after-action review in the Southeast for all of the states affected by Helene earlier this year. We've already been asked to do one in California for health clinics to really look through, what worked, what didn't, and what kind of recommendations we collectively can make to be better prepared in the future. And that looks like everything from physical goods to coordination mechanisms to staffing contingencies to business continuity and security. How do you make sure your computers and your patient file systems are going to work? So really kind of looking across that. We work with, we run tabletop exercises for clinics. So we really try to the best that we can simulate an emergency and set conditions and have them think through how their plan would roll out. We put surprises in there. Okay, you've had, this hurricane, now all of a sudden the power goes out. How does that change? You're sort of 2 days into your response and to try and really replicate real world scenarios that they might have to face and just continue to test and action those plans so that they're better prepared when it does happen.
Right. Well, I mean, you talked a little bit about sort of recovery and some of the longer term planning. I mean, is there anything else that you'd like our audience to know about the response? Anything that we haven't really covered?
I think I would just reiterate a couple of things. I mean, I think just as the fires have been contained, this response and recovery is not over, and it is going to take quite some time. And certainly International Medical Corps is committed to being there and to helping these communities and particularly health facilities and families recover from this with both mental health and medical care. And really kind of thinking through that preparedness. But I think it's just, the way the news cycle goes in the United States, it's sort of off the pages and out of people's minds. And I think it's going to take quite some time for this community to recover. And I think we've seen that, this disaster was at the scale of things like Hurricane Katrina and Superstorm Sandy, where you just have communities that are just completely devastated. And so the road back is a long one. And so I think just highlighting that. And I said this at the top, but just really want to highlight the tremendous amount of support we found from California-based medical providers and mental health providers. We've got 31 people, on our volunteer medical and mental health teams on the ground. Nearly all of them are from either Los Angeles area or other places in the state. And I mean, they responded so quickly. They've made themselves so available. They've been incredibly flexible and adaptable as the response has changed. And I can't thank them enough. And what they've done to kind of step out of their day-to-day lives and be able to come in and help people in Los Angeles County is remarkable. And so would just highlight them and thank them as well.
Yeah, we have an amazing group of volunteers that are just, there with us every step of the way. It's really wonderful. And we also have incredible donors and supporters. And so just want to reiterate our thanks and appreciation for everyone that supports International Medical Corps, both our response here in Los Angeles, but then also our worldwide work. In this time of change and everything that's happening, it's really important for us to remain committed to serving people that need our help. And just want to thank everyone for standing with us. Erica, do you have any kind of final thoughts before we close?
No, just thank you again. Thank you again. And just appreciate. And, of course, we're always honored to be able to help.
Yeah. Okay. Well, again, thank you all for joining us today. Really appreciate it. And we'll continue to keep you updated on our response. You can get daily updates on our website. So please do look there for that. And I know that we're going to also share the mental health resources so that you can take advantage of those or share them with friends or affected community members. So thank you everyone for joining us, and we look forward to seeing you on the next briefing. Thanks, Erica. Appreciate it.